The Eat Like Ruby podcast is not a substitute for professional medical or dietary advice. The advice given in this episode is general in nature and should not be used to treat any medical conditions, health conditions, illnesses, injuries, and/or any nutrition-related conditions, deficiencies, or similar. This podcast is not to be used as or in place of medical advice or dietary advice. Please consult your healthcare professional before implementing any of the advice, information, or protocols discussed in this episode. Welcome to the Eat Like Ruby podcast. The episode you're about to hear is part of our Women's Health series. For the month of June, we have 8 episodes and 4 expert guests covering a range of women's health topics and how they work alongside being a health-conscious gal pursuing nutrition, training, body composition, and performance goals. Throughout these episodes, we'll be covering the menstrual cycle and its phases, how these phases might impact our nutrition, training, energy, and performance, as well as managing cravings and potentially adjusting our diet and or our nutrition to suit different times in our cycle. We're also going to dive into PCOS and endometriosis and managing our nutrition, training, and goals alongside these conditions. We have a guest expert who's going to break down perimenopause and menopause and explain exactly what is happening in the female body at this time, the changes it may have on our nutrition, training, lifestyle, health, and body composition, as well as things that we could look at adjusting with our nutrition and or our training during this phase of life. And we will be jumping into a pre- and postnatal chat, covering all the things we should know about navigating our nutrition and training during this time, and potential changes to make to these things through different trimesters, as well as hearing from Eat Like Ruby nutritionist and trainer Emma Roth about how she is personally navigating all of this being 30 plus weeks pregnant. These episodes will drop every Wednesday and Friday on the Eat Like Ruby podcast for the month of June, starting on Wednesday, June the 4th. And today we are joined by expert guest Sophie May, who was here last week explaining the menstrual cycle and its phases and anything we should think about while we navigate our nutrition and training alongside that. Sophie is back today with a more niche-specific topic, honing in on PCOS and endometriosis. So in this episode, she's going to explain and break down what these conditions actually are, what is happening in the body when we are navigating and dealing with PCOS or endometriosis, and then looking at potential things we could adjust with our nutrition and training so we can continue to look after ourselves and our health and our body while still achieving our goals alongside navigating either one of these conditions. It's time for the next questions. My question literally says, what is endometriosis? What is PCOS? So these are two completely separate things, hey?
Yeah, two completely separate things.
Do you see people with both, or is that quite rare?
I wouldn't say it's rare. I mean, you definitely can. I think if we look at what PCOS is, let's go through that first, because I think that's very, very common.
Yeah.
Now, PCOS is described as you may have polycystic ovaries on an ultrasound. You won't always have polycystic ovaries on an ultrasound if you have PCOS. So that's definitely not like it's a solid. It's just that you may show that. You need to have bloods done to diagnose PCOS because PCOS is categorized by elevated androgens and male hormones on a blood test. And if you aren't showing that, then you do not have PCOS. You need to be able to see this on a blood test. So that's why there's a big issue with the diagnosis of PCOS because, one, you might go for an ultrasound and go, oh yeah, you've got polycystic ovaries, but you can have polycystic ovaries. What this is just follicles, is the follicles that are just not developing into being ready to ovulate. So that shows as polycystic. The name is so wrong because like if you've just come off the pill, right, you haven't been ovulating on the pill. If you went and got an ultrasound, you would show polycystic ovaries on an ultrasound because you haven't been ovulating. So it's not because of PCOS, it's simply just lack of ovulation is going to cause those follicles to be showing there.
Yeah, right.
So that's the first thing. And then the other thing is that with PCOS, we have, like I said, the elevated male androgen and testosterone hormones. So if you're not showing that on a blood test, you can still have irregular periods without having that, but it's not PCOS. So that needs to be confirmed. And a lot of people are just going for ultrasounds and being like, yep, you got PCOS. And it's annoying because it's fear, like it's very, very fear mongering, especially when you've got a young woman who doesn't understand what PCOS is, for example, doesn't understand how their body works. And they're going, oh yeah, you've got polycystic ovarian syndrome. Like that sounds pretty intimidating. They're thinking, oh my God, what does this mean for my future? The doctor's just saying, oh, just go on the pill, we'll figure it out later. So it's a very scary thing for people because no one gets any information on it. And it's rightly so to be worried, because the first thing that obviously we think about is fertility. And like when you're 20 years old and you're getting told that you have that, I mean, maybe a lot of 20-year-olds don't really care about the fertility, but it's still like a big fearful thing, because it's like your future could be compromised. Basically, that's what they're hearing. With PCOS, it can be managed and it can be reversed, because what we are looking for is the reason that we have those elevated male hormones and the reason that we have the irregular periods. The biggest driver of that in PCOS is insulin resistance or blood sugar issues. So if we reverse and step back and go, okay, well, we can manage insulin resistance, we can actually manage blood sugar issues, we can then fix that root cause to where that hormonal imbalance is, and then we can come back to having normal male hormones and regular cycles again. So if anyone has PCOS and they are generally, or maybe you've just got a diagnosis and you have this fear of, how this might impact your future, I think the biggest thing that I want to say is, like, don't let this completely scare you, because I do think that there's a lot we can do with PCOS, and it's not an infertility diagnosis. That's probably the biggest main point I want to make. So absolutely not an infertility diagnosis. So going back to the question, if we look at what PCOS is, can you have elevated male hormones and androgens with endometriosis? You can, yeah. So you can still have both at the same time. With endometriosis, we are looking at tissue that is similar to the uterine lining, grows outside of the uterus. So that could be on the bladder. It's been found all over the body, I'm pretty sure, on intestines and things like that as well, on the outside of the uterus. So the ovaries, the fallopian tubes, so that tissue can grow in places where it shouldn't be. So completely different condition.
Yeah.
When it comes to hormones with endo, there is still a hormonal factor, but we're looking more at estrogen being that hormonal factor with endometriosis. So that's the main differences. And we are then looking at different symptoms as well. So with endo, our main symptoms are definitely going to be the pain aspect. That's probably one of the biggest signs that someone may think that they've got endometriosis. With PCOS, pain is not a symptom of PCOS. So can you have pain and have PCOS? Yes. But is your pain driven by the PCOS? No, that's driven by something else, whether that's inflammation. Yeah.
I think
So
that's
hopefully that
really
kind of in a
interesting,
nutshell.
because I think a lot of people, well, maybe it's just me actually, but I've heard so many people that have really severe period pain and they say, oh, it's because I have PCOS. So when I get my period, it's so insanely painful because I have PCOS.
Yeah, this is common. Like, I see this a lot, and I've actually got a really good story to share about this. Not me, but someone actually messaged me. She was a coach as well, and she was like, "Oh, my periods are just so painful. Like, I literally have to lie down. Like, I feel sick. I have to take painkillers. I've got really bad IBS. Like, my stomach bloats. Like, my lower stomach just bloats like crazy." Which, if anyone listening has endo, like, you'll probably relate to that as well. And she was like, "Oh, I think I've got PCOS," and I was like, no, like, do you have irregular periods? Do you have this? Do you have this? She's like, no, I've got none of that. I was like, no, I don't think you've got PCOS. Like, your symptoms sound a lot more in line with endometriosis. She didn't even know how to say the word. She was like, endo what? Like, had no idea. So she eventually she was in the UK, so the medical system does work a little bit differently. She eventually went through the private side and got diagnosed with endo eventually. And she was like, oh, wow, like, I don't even have PCOS. Like, they diagnosed me with endo, and that was the cause of my symptoms. So it just goes to show that, I don't want to say the whole system, but like, if doctors can't even diagnose it right, like, how do people know what's going on? Like, you know what I mean? So like, the fact that she was diagnosed with PCOS when she didn't have the symptoms and her symptoms were completely different, it just goes to show that it's easy for people to have that thought, like, oh, this is why. But period pain is caused by, inflammation. Your hormones can definitely play a role. Like, if you have lower progesterone, which, if your periods are irregular, can be a factor, because obviously we're not ovulating regularly, which is where we get that progesterone from. But it's not directly the PCOS. It's almost like everything else that comes with it, and that is happening because of the lack of ovulation and that side of things, potentially even lifestyle factors, not for everyone, But lifestyle factors can definitely play a role as well. Like that's where that pain is coming from and not directly because of that single condition, if that makes sense.
Yeah, yeah. So
Yeah.
interesting. Hey.
Yeah, really interesting. And it's crazy that a lot of people think PCOS is, I've got really bad period pain. I think I've got PCOS. And it's like they're not really related, but obviously you can still have both. Like,
Yeah.
Yeah.
Yeah. So if we look at PCOS, can it get to the point where it's like cured? Like I had PCOS, but I do not have it anymore.
Yes, this is definitely controversial on Instagram. Like, I've seen so many people being like, PCOS can't be cured, like, there's no cure for it. But this is where I go, okay, well, let's look at what PCOS is. Now, we just went through that, obviously.
Mhm.
If someone has insulin resistance, can you reverse their insulin resistance? Like, forget PCOS. Can you
Yeah.
reverse their insulin resistance through lifestyle and diet and nutrition and things like that? The answer is yes. So,
Yeah.
if we can do that, there's no reason that we can't reverse PCOS as well, because that is often what's driving it. Now, if there's
Yeah.
something else driving it, most commonly it's insulin resistance, which is why we always talk about that. For example, you can have post-pill PCOS, which isn't a medical term, but if you just come off the pill, your body will be in like a state of PCOS where your androgens are going to be a little bit elevated because you've been on the pill for, maybe a while. You're not ovulating regularly because your body's trying to re-regulate itself.
Mhm.
Those sort of symptoms are PCOS basically, and you can show that on the blood test, but it doesn't mean that you've got it forever. Once you sort of get your body back to normal and your body re-regulates itself, then you probably will just end up that just drops, you don't have PCOS anymore. So yeah, it's not always just a lifetime diagnosis, and I think that's really empowering to know because yeah, like I think again, we go back to where people are told they've got it and it's like this big scary thing. When in reality, if we were able to say to people, hey, your bloods are actually showing PCOS at the moment, but here's some things we can do, it would give people so much more confidence in knowing that, you know what I mean? Like there's something we
Yeah.
can actually do about it.
Yeah.
Yeah.
And correct me if I'm wrong, but people go in for surgery on this? Like,
No,
or is that
not
endo?
PCOS. That's endo. Yeah.
So
So with
people have
endometriosis.
like cysts on the ovaries. Do they get any procedure for that?
So, with the cysts on the ovaries with PCOS, there's two different types of cysts we're talking about here, and this is why the name is confusing. So,
Yeah.
you can get ovarian cysts
Yeah.
where you will
But
have a
then you
swollen
don't
follicle.
technically have PCOS. Is that like what you were saying before?
Yes, so ovarian cysts are a different thing. That's
Yeah.
where, like, I could get an ovarian cyst even if I
Yeah.
don't have PCOS. So that's where you might get that sharp pain. Like, some of the ladies listening may have had a ruptured ovarian cyst or know someone that has. That's different to PCOS.
Yeah.
PCOS, what you're looking at on an ultrasound is the ovary where we've got lots of undeveloped follicles.
Mhm.
So those follicles contain the eggs and they will then mature slowly over 3-month periods. And one of them, when you ovulate, will then be ready to release the egg. That's what your ovulation is.
Mhm.
So when we're looking at polycystic ovaries on an ultrasound, we're basically just looking at lots of undeveloped follicles in the ovary, which just tells us that that person hasn't regularly been ovulating or
Yeah.
hasn't recently ovulated. So if you've been on the pill, for example, and you've not been ovulating for the last 5 years, that will show on the ultrasound. It
Yeah, that
doesn't
makes
mean
so
that you
much
have
sense.
PCOS. Mm-hmm.
Yeah. And then, so if somebody has endo, again, same
Mm-hmm.
question. Can you be in that position where it's like, yes, I had endo, it is now cured, I no longer have it?
Endo's different. Endo can't be cured. It can be managed to
Yeah.
an extent, but it's a very different condition to PCOS. So that's
Yeah.
that's a like again what you were saying, like it's good to differentiate between them because PCOS, yes, I believe, can be managed and reversed. Endo, not so much. It's very much something that we want to look to manage because we do want to slow the further growths. So when someone goes in for surgery to get endometriosis removed, that removes the tissue that's grown, but that won't stop the future tissue from being developed.
Yeah. Right. That makes so much sense.
So then what we think we want to go, well, how can we slow down the growth of any future tissue being developed? And that's where we come into the management of it. And that could be there's quite a few different things that we can go into. But yeah, that's where PCOS and endo are quite different with those.
Yeah, cool. Well, that was kind of like my final question, but I feel like it might be a bit of a big one. If somebody came to you right now and said, I want to work on my nutrition training, I have
Yeah.
endometriosis. What are you, or are you doing anything differently versus if someone came along and they didn't have it?
So with endometriosis, I think the first thing I would do with clients is I'm a big fan of a gluten-free diet for endo. I've seen a lot of clients. Again, this is where I wouldn't just I wouldn't just say everyone needs a gluten-free diet, but I do think that when we have seeing endometriosis, it does have really, really impactful benefits.
Yeah, right.
Gluten-free approach is definitely one of my lifestyle factors that I implement with clients. I think it's a lot easier these days to eat gluten-free as well. It's not as depressing as it once used to be. So that's definitely a first, because what that does is that basically helps reduce it can help reduce the pain, not on its own, but it definitely has impacts. Like I had a client who, when she went gluten free, like her period pain definitely reduced quite a lot. And she then started eating gluten again and the pain came back again.
Wow.
So that's definitely like an easy one that I think is like, let's see how it goes. You have to do it for 3 to 6 months to get benefit from it.
Hmm.
But in my opinion, like when we're dealing with something like endo where the pain is so severe and it can massively impact someone's life,
Yeah.
let's give it a shot. Like let's really try and give this a shot and see how it impacts us. That's the first one. Training wise, I think with endo, there's no set rules. I think it's more so just they need to just be really aware of how they're feeling, and they
Yeah.
might find that like high intensity training just impacts their flares a little bit.
Hmm.
So they might notice that, for example, let's use CrossFit. CrossFit might flare them up a little bit just because when you're doing such high intensity training, your levels of inflammation to recover are going to increase as well. And then that can then drive some of those flares that we see, maybe not on its own, but it
Yeah.
can definitely contribute. So those people may want to be mindful of where, maybe they get their flares more so around their period. Not everyone, like some people can just get it randomly as well, but around their period, they might try and opt for, this is where I would say maybe they will opt for some lower intensity training like Pilates or walking and just keeping things really low, or just static weight training where we're not kind of doing, crazy hit training or high intensity movements. So that's definitely a time that I would suggest that. Some people with endo may find that they have learned how to manage it quite well and they don't need to worry too much about that as well.
I feel like
There's
it's
a few.
almost like what we said at the very beginning, where obviously
Mm.
these people have another factor to consider, but really learning how it actually affects you and at what times and all those things, and then working with that.
Exactly. Yeah. So, like, although we can say these are what symptoms they're going to get, they may still, person to person, get different extremes of those symptoms. I've seen some women who, literally bedbound by endo, and I've seen
Yeah.
others who have kind of managed it quite well and they tend to don't experience it to that extreme anymore. So, yeah, there's a few supplements that I think are really good for endo. And one thing that I think is probably not often spoken about is something called endocrine disruptors. I don't know if you've looked into this much, but I mean, this is where this conversation, like, we're exposed to so many toxins in our environment. We all know that. I just think if we can manage it and reduce it where possible, like, why wouldn't we? So you've got two different opinions on this. It's like, oh well, everything's toxic, blah blah blah. What's the point worrying? Whereas I just think, well, that we are exposed to things we can't control, but if there are things we can control that may help us, like why wouldn't we do that? And
Yeah.
I think when you look at endometriosis and the pathways of which estrogen is metabolized, one thing we want to be mindful of is just helping to reduce any excess things that will impact our hormones, and endocrine disruptors do impact our hormones. So if we can, make a switch to a natural deodorant, or if we can be mindful of the amount of perfumes and scents that we're using and things like that, like we're still contributing to lowering the overall exposure. So that's also quite a common thing that I'll definitely talk through with endometriosis clients as well. Everyone will benefit from it, but in my opinion, I think it's definitely important for them to be really mindful of as well.
Yeah, right. And just quickly, like when you say endocrine disruptor, is that just like a toxin?
An endocrine disruptor is a chemical like compound that's found in things. It's found in loads of things. And this is
Mhm.
where I want to say, like, I don't want everyone to just go and freak out about, oh my God, everything's bad for us. Like, that's not what I'm saying. For example, like conventional deodorants like the aerosol sprays or hairspray. Obviously, for females, we're exposed to so much more because of the personal products we use.
Yeah.
Even things like non-organic tampons, like they contain pesticides, which are just going directly into our bloodstream. So if we can switch to like an organic cotton where there are no pesticides used, that's going to have, a little bit of a benefit to us as well. So it's
Yeah.
basically like a chemical compound that enters our bloodstream and acts as like a hormone disruptor. And they haven't been heavily researched, but you will see a lot of women's health practitioners talking about it because I really do think it has a lot of benefit for us, and it's not just females, it's males as well. But like I said, even just switching to like a natural deodorant, even just being mindful of the amount of perfume or sprays you're using, if we can reduce what we're using, whether that's like a fake tan, if we can swap to more of a natural one, or even just things like not heating plastic in the microwave. Like I know that's quite common, but when you're heating plastic in the microwave, you're heating up all of those particles that are just leaching into the food. So even something like that is quite a small swap that someone can do in their day to just reduce their exposure.
Yeah.
I know it sounds a bit weird when you hear things like this if you've not heard it before, but I do think it's something that we want to be mindful of because I think there's a lot. We're exposed to a lot, and I think if we can reduce some of it to help our hormones, then why not? Yeah.
Yeah, for sure. And I think, especially like we said before, if a person is dealing with like really severe pain and symptoms and all of that, I think it's like anything in life. If you have enough of a drive to change that, like if you're going through
Yeah.
that and someone said, oh, you might get a bit of benefit by swapping deodorant and tampons and
Yeah.
perfume. If you're going
Yeah.
through such pain, you'd probably be like, hell yeah, I'm going to get those
Yeah.
right now.
100%. Yeah, like that's definitely some changes I made when I was experiencing really bad PMS symptoms. And I was like, even if it just helps 10 to 20%, like it's still better than what I was experiencing before. And that's sort of how I try and view it.
Yeah, for sure. And so I guess same question, someone comes to you and says, I want to work on my nutrition training. I have PCOS. Is there
Mm-hmm.
anything particular you're doing for this person compared to someone who comes along and doesn't have it?
Yeah, so when we look at, I guess, PCOS, because we're looking more at the lifestyle side of things with the nutrition. So obviously with endo, we're not looking to sort of fix insulin resistance or reverse that. We're kind of looking to just manage how they're feeling and do what we can to help them feel better.
Yep.
With PCOS, it's like we actually can re-regulate your cycles. We can manage your blood sugars and we can get you back to a, healthy, regular cycle, feeling good and not having those symptoms that you may be experiencing with PCOS. So you might get intense cravings, you might get fatigue, you might get, where people kind of get like they notice their mood is really impacted by if they're hungry or if they're sort of having like a blood sugar low and things like that. We can definitely manage all of that with our nutrition, most importantly. So that's always the biggest focus for me, because I'm not saying that if you have PCOS, it's because you're causing it. It's more so just that we can have habits that stem from childhood that maybe, how many people get taught how to eat enough protein? Like, I know that that's such a simple thing, but that's definitely one of the first things we'd be working on is to how can we stabilize your blood sugars, because that's a big factor for PCOS. So
Mhm.
enough protein at each meal, having satiating meals, not just small snacks across the whole day, eating sort of every 3 to 4 hours. I think that's quite a common one that people just kind of maybe don't eat. Like I always, again, you forget that people do things differently to you. Like I just eat every like 3 or 4 hours because I'm just, by then I'm kind of hungry anyway. But I noticed actually someone said something to me. They're like, oh, I only really eat when I'm like starving. And I was like, that's why you're feeling this way, because you're not eating to kind of bridge the gap. You're just eating when you're like at the point that you could demolish anything. So, I mean, this isn't just PCOS. I guess this
Yeah.
is related to everyone, but that's definitely a big factor in managing blood sugars and not letting yourself get to the point that you are tired, you're starving, you're craving everything. Training wise, like weight training and walking is perfect combination for PCOS. Like we don't need to be doing super long hit sessions or loads and loads and loads of cardio, which I think people are often led to believe because they think, oh, well, I struggle to lose weight, so I need to do way more cardio. You actually can benefit just a lot from weight training and walking. Nothing wrong with doing extra cardio if you like it, running, whatever. Supplements wise, I think there's a lot of supplements that can really help. So Magnesium, of course, is always the one that I like. Also, looking at a good quality omega-3 supplement, that can be really beneficial as well. NAC, it stands for N-acetylcysteine. Hopefully, I've said that correctly. That's a really, really good one. Also for endo, but PCOS definitely. And one more that I really love is myo-inositol. So all of these supplements sort of come together to help support blood sugars, your cycle in general, like we spoke about magnesium with the feelings that you're getting, recovery, sleep, stress management, nervous system regulation. So all of these kind of come together just to support what we're going to be doing with nutrition and training as well. So yeah, it's definitely a big focus on like lifestyle, I think, with PCOS and just being patient. Like it's not going to be fixed with 2 months. It's going to be a lifestyle progression that we'll probably be seeing over, more like 12 months if we're being realistic. So yeah, hopefully that answers the question.
Yeah, for sure. And I feel like one final thing that clocked in my mind is I think this is really common. I think it'd be so good to answer this question. If people have either of these conditions, it might be different for each
Mhm.
one. Is it harder for them to achieve fat loss and weight loss?
I think it's harder because of
The
the way it
symptom.
impacts.
Yeah.
Yes, yes. That's how I try and frame it to people is I don't it's not necessarily the condition, it's
Mhm.
because the condition can impact your ability to stick to the things that we need to do.
Yeah.
So if someone with endo is bedbound for 5 days of, the month, like that's going to impact their ability to walk and eat properly because they might not be able to cook and stand up for hours or things like that.
Yeah.
With PCOS, you might be more susceptible to cravings and your hunger, like your hunger hormones can be a little bit dysregulated as well. So that then will make it a little bit more difficult for fat loss, but it doesn't mean you can't do it. It's more
Yeah.
so just again, working backwards and trying to help the cause of it, like if we're looking at PCOS, the blood sugar issues, is also going to help the symptoms.
Mhm.
So it's kind of just being patient and just like knowing that once you start noticing the benefit of those, it will definitely become easier. And like we spoke about, the protein, the quality of foods, tracking, like all those things still definitely play a role. And I've seen plenty of PCOS clients lose weight. It's definitely not impossible.
Yeah.
I just think that often there's this like belief that, oh, I've got this, so I can't lose weight. And often that will then, if
Yeah.
you believe that, then you will struggle losing weight. But it's not true. So I think just believing that there is an approach there, and yeah, it's not impossible at all.
Yeah, for sure. And that makes so much sense. So, would you say there's nothing happening in the body that's actually stopping the body from achieving fat loss? It's more the flow on effect from other things?
Yeah, it's definitely more the flow on effect more than anything. I mean,
Yeah.
with insulin resistance,
Yeah.
it's a catch-22, isn't it? Because insulin resistance, where your body's like struggling to properly manage blood sugars, like does lifestyle factors impact that? Yes. But also, does the insulin resistance cause things that make it harder to lose fat? Also, yes. But then we go back to square one and go, well, the things that we need to do to help it are also going to help us lose weight.
Yeah.
So is it the insulin resistance, or is it that we just haven't quite found the right approach to what we need to be doing to help support that and see that weight loss coming down? I don't like speaking in definites and saying like, no, there's definitely nothing. It's more so just framing it in a way that it's like, yeah, because a lot of people do talk about the fact that, oh, I can't lose PCOS because of PCOS, or you're going to struggle. So yeah, I don't like saying absolutely not, but I also like saying, well, is it actually that, or is it the knock-on effect of what we're experiencing?
Yeah. And almost coming back to what we said at the very start, like understanding it and then working with it.
Yeah, exactly. Yeah. And again, knowing that it's not a one-way ticket to the fact that you're never going to lose weight, you're never going to be able to conceive, like just being really aware of those things, because it is really frustrating to experience something like that and being told that you have this thing that's going to make you harder to lose weight, you're going to struggle to conceive, which is just completely wrong. Again, if we go back to the fact that PCOS is mainly a lack of ovulation, can we fix that? Yes. So that doesn't mean you're infertile. So yeah, like I completely forgot even what the question was, because I just keep going off on tangents.
No, but I
Um,
feel like you almost just confirmed it with saying like actually understanding what's going on
oh
and
yeah,
then how do we work with what's going on?
yeah, yeah, for sure. And I think, I mean, I don't want to be biased, but I think having a coach, whether like whoever it is that you trust and like, is so important because it just helps you be consistent, and it really helps you kind of make this the final time to achieve your goals and know how to do it long term. I think it's really hard when you're looking at all this information
Yeah.
and then you'll have, like, if it was easy to lose weight in the first place, everyone will be able to do it super easily. Like, Google has all the information you need, but it's not like that doesn't help people because there's no sort of guidance, there's no support, there's too much information. So I think just trying to just, if you're in a position to, or at least following the people that are able like to give you that free value,
Yeah.
just support yourself with someone that can just give you that one approach, because otherwise, you know, you see even on PCOS, it's like you need to cut out dairy, you need to cut out gluten, you need to cut out sugar, and like it's just so confusing for people, and that's just going to get you confused, going in circles and just never actually getting an outcome from it.
Yeah. Yeah, for sure. I couldn't agree more. I think you have to sort of decide like what info am I going to take in? Who am I going to follow? And whether it's actually
Yeah.
like physically follow on Instagram or whose advice am I going to follow?
Yeah.
Like just picking that path. And yeah, I think your info in these episodes has been so helpful for people to get started with that. Because I think it comes down to your doctor and stuff as well. I think some people can get a really good doctor and they can take you through a lot of the stuff we've just been through, or you can just get those doctors that go, oh, well, it's PCOS, good luck.
Oh
And
my God, yeah,
that's so
literally.
disheartening.
Yeah, it is. And like one thing we haven't touched on actually is the role of like birth control in PCOS and how that actually isn't a fix for it. That's probably a good one to touch on, just because I know that if there's anyone listening that's got PCOS, that would have been the first thing that they've been told to do. And the way that I always frame this to women is like, well, if we look at, like, again, we're always looking at the way that these things work. So does the pill contain anything that's going to help balance your hormones? No, because what the pill does and how it works is it switches off the communication between your brain and your ovaries to stop you from ovulating. That's what it was made for. That's the whole job of the pill, is to stop you from ovulating, to stop you being fertile. So with PCOS, if we're trying to regulate periods and ovulate more regularly and reduce male hormones, which actually the pill can increase, is that going to fix it, or is that going to just mask the issue until we come off the pill and experience natural cycles again and we have the same issue? So yeah, I think just having that open-mindedness towards other ways to manage things is really important, because I always say this to clients, but the medical system and the doctors, the GP, they're not there to fix you. Like, I know that we expect them to have all the answers and we expect them to be the ones that are going to help us, but the GP is literally just a general practitioner, and getting annoyed at the fact that they're not doing anything isn't going to change it. That's where I really like, you know, let's take responsibility to kind of investigate our own health and look at alternative options to just the GP.
Yeah.
That's where you can look at women's health coaches, and I don't know if you're into naturopaths and things like that. Like, look at alternative options, because if you're putting all of your eggs in that one basket, you're never going to get any information or cure or manage whatever you're looking to do, because it's just not the role of those people. I think just having that open mindedness to look elsewhere as well, and being okay with the fact that we're not going to get everything from them, and that's okay. Let's look elsewhere.
Yeah, for sure. So speaking of that, I feel like this is a great place to wrap up, but obviously I'm going to assume you take on clients and you work with people with these conditions. This is literally what you do.
Yeah. So that's pretty much me. I don't just do the health stuff. It's more just a blend. So like if you're someone who does want to improve your relationship with food, and you do want to, I don't know, maybe it might be lose weight, lose fat, tone up, build muscle, it's almost like the ability to kind of blend everything together and go, let's do that, but also let's look at, if you do have PCOS, let's look at managing that. If you do have endo, let me help you manage your symptoms. If you just generally have, you know, cycles that you want improving and maybe they're regular but you just get really bad PMS, like, let's look at improving that as well. You don't have to have any of those things to work with me, but it's quite nice to have the blend where it's like, instead of having to go see a naturopath and then go see this person and then go see a PT, it's like, all right, we can do everything in one go. So yeah, that kind of sums it up in a nutshell, I think.
Yeah, and I love that so much, because I feel like people would feel like, oh, my GP for this and my nutritionist for this and then my PT for this. And then again, if they start telling you conflicting things, you're like,
Yeah.
now what? So I think that's awesome. I feel like you've got such a good niche, I guess you would call it, but I think it's a big niche. I think there's a lot of people who would need that combination of support. So I think that's unreal. And I think there's going to be a lot of women listening, putting their hand up right now.
Thank you so much for having me, Ruby. Honestly, it's such a good podcast to talk through. And yeah, just hopefully people have just taken something away and either feel more confident in their own knowledge of their own cycle or have learnt something. So yeah, thank you for having me.
No worries. Thank you. And let people know where they can find you. Is it predominantly Insta?
Yeah, I'm mostly on Instagram, just under Sophie May Fitness.
Well, check out Soph, guys. And we are most likely going to have split this episode in two. So if you've listened to this one, there's probably one before it. So go and check that out if you haven't. But then definitely check out Soph on Insta and hit her up if you've got any inquiries, anything that you want to get stuck into.
Yeah, for sure. And if anyone has any questions that maybe we skimmed over today or that you're thinking, oh, actually, I've got a question about what you've said, feel free to drop me a message. More than happy to expand on anything that you might be wondering as well.
Yeah, definitely. Send it to Soph, not me, because if you send it to me, I'm going to ask Soph and then I'll just
we'll just go back and forth.
So definitely.
Thanks, Ruby.
No worries. Thank you so much for listening, guys.